Okay. Good afternoon once again.
Good afternoon, sister.
Good afternoon. Good afternoon. Good afternoon, sister.
Okay. So as I said earlier on, this semester we are going to look at advanced midwifery and theater nursing. And today I want us to go through the course outline for today. So we are going to go through the course outline. And since you know me, there is no need to introduce myself because you already know me. So we are looking, as I said, the course is Advanced Midwifery and Theater Nursing. Advanced Midwifery and Theater Nursing. And it's supposed to be 3 credit hours. 3 credit hours. So we are looking at the course description. The course description. I wish I can. Oh, I don't know why. I don't know why the video is not coming. Well, okay. So we are looking at the course description. Okay. So this course is designed to equip the student midwife with knowledge and skills in operative midwifery procedures. The course allows the student midwife to appreciate the membership and role of the theater team and assist the obstetrician and gynecologists to perform operative procedures. Furthermore, it equips the student to conduct obstetric operations, perform life-saving procedures, manage obstetric emergencies, pre- and post-operative preparation and management of the client. Additionally, the student midwife will be able to identify and use obstetric and gynecological instruments, as well as address the risk of general anesthesia and its prevention. So what this course is telling us basically is that as midwives, it is not only labor ward and ANC and postnatal wards that we will find ourselves. We'll also find ourselves at the theater. And so at the theater, we should know what goes on inside the theater. We should be able to assess the obstetrician or the gynecologist in performing any operative procedures. Then we should also be able to conduct some basic obstetric operations, like giving a pace, taking care of the pace, helping in vacuum extraction, helping in cesarean section, and all those things. Then we also perform life-saving procedures. So, like when a woman is sent to the theater, whatever that goes in there, if there is a need for us to maybe perform CPR for the patient, for the client, or for the baby, we should be, as midwives, you should be able to do it. Then we should be able to manage obstetric emergencies. What are some of the obstetric emergencies that we, the midwives, can perform? Please, it's a question to the class. What are some of the obstetric emergencies that we midwives can perform?
Resuscitation.
Bagging.
Yes, resuscitation. We are resuscitating the mother and the baby. Yes.
Sister, please, management of postpartum hemorrhage.
Okay, yes.
And
It's
also
an obstetric. Yes.
chest compression.
Okay. What else?
Management of preeclampsia.
Management of preeclampsia. Please, if you know, you just raise up your hand. Okay. So management of eclampsia. What else? What emergency situation can we also do as midwives? Cold prolapse is an emergency, or isn't it?
It is.
Yes,
Yes.
It is.
So all those things, emergencies, we can also do it. Then we will also be able to manage a patient pre-op and post-op. So when a patient is going for cesarean section or any of the ops and gynae conditions, we'll be able to prepare the person for the operation. Then when the person comes back, we'll be able to manage the person post-operatively. Then we'll be able to identify and use obstetric and gynecological instruments. So you know there are some instruments that they use at the theater, especially the OBJ and the ops and gynae theaters. So as midwives, we should be familiar with those instruments so that when the doctor is doing or performing any surgery, we will be able to assist the doctor and we will be able to pass the right instrument that it needs. Then you know that when a woman is going for cesarean section, they give the person anesthesia, whether general anesthesia or spinal or whatever. We should be able to know the type of drugs that will be given and the complications that each drug can bring, so that together with the anesthetist, we can prevent any complications. So basically, this is the course description. Then when you go to the course objective, so by the end of the course, the students will be able to describe the membership and the role of the theater team. So we are, as we go along, we are going to know the role of the members at the theater. You know, when you get to the theater, okay. Please excuse me, give me some. Please, are you there?
Yes, sister.
I'm very sorry. I'm very sorry. I had some visitors in my office. I've asked them to do something. I'm waiting for them. So let's continue. When they come, then I will attend to them. Okay. So as I was saying, we are going to describe the membership, the theater. We have teams and the role each team play. So we will look at that. Then then we are also going to assist the obstetrician gynecologist to perform operative procedures. Then we are also going to conduct obstetric operations, as I've already said. Then we are also going to perform life-saving procedures like cardiopulmonary resuscitation and newborn resuscitation. So when a pregnant woman is on the ward and the person ceases breathing, what are we going to do? So we are going to look at how we can do that. Then We will also identify and manage obstetric emergencies. Like what I said, we are going to look at cardiac arrest. If a woman is having a cardiac arrest, how would you know? And how are you going to manage it? We are going to look at eclampsia. We are going to look at asthma. We are going to look at shock. Then asthma is a pregnant woman having asthma. Then we will also manage patients pre and post-op. So how we are going to prepare a patient for any obstetric procedures, like CS, vacuum, pace, and all those things. Then we are also going to identify and describe the use of obstetric and gynecological instruments. Then we discuss the risk of general anesthesia and its preventions. So from there, we go to the course content, the content of the course itself. Oh. Okay. So with the course content, we are looking at as I said, the theater team, their members and their roles. So when you go to the theater, we have the sterile and the unsterile. And even, please come in. And even with the sterile and the unsterile, we have people in it. That's what they do. Okay. Then we are also going to assist in common operative procedures. We are going to set trays and trolleys. Oh, this network is worrying me. Okay, so we are going to set trays and trolleys. Then we will also be learning how to receive and position clients or patients, skin preparation, draping of patients for operations. Then we also look at obstetric operations. Then we perform life-saving procedures like what we've already said. We'll look at obstetric emergencies in the theater. We'll look at eclampsia, antepartum, and postpartum. Then we also look at cord prolapse and amniotic fluid embolism. So these are the obstetric emergencies that we are going to look at. Eclampsia, antepartum hemorrhage, postpartum hemorrhage, cord prolapse, amniotic fluid embolism. Then we'll also look at pre and immediate operative care. Pre and immediate operative care. Then we'll look at instruments used for obstetric and gynecological. Oh. Operations. Then we'll also look at hand washing. We'll look at hand washing and the use of PPEs. Hand washing and the use of PPEs. Then we'll also look at anesthesia and its complications. Then So these are the content. These are the content. So we are looking at teaching and learning strategies, what we are going to do. So we are going to look at, we will use lecture method as I'm using. We will use group presentations. Then because it is Zoom, we can't use demonstration, but we can, if we want to demonstrate something, we can use videos. We can use videos to demonstrate something or to enhance learning. Then we will also use online. Our lecture is online. So with the assessment, we are going to use combination of formative and summative assessment, including online quizzes, group presentations, assignments, and examinations. So the examination will be mid-sem and end of semester examination. So this is how it will be. The assessment, the quizzes will form, if we are able to do online quizzes, it will form 10% of our end of semester marks. Group presentation will be 10 marks. But if we are not able to do the quizzes, the group presentation will be 20 marks. Then midterm exams will be 10 marks. Then end of semester exams will be 70 marks. So I will pause here for any questions. If we have any questions, you can ask. Please, I'm pausing here for any questions. If you have any questions, you can ask. Please, do we have any questions?
No, sister.
No, sister. No, sister. No, sister.
Okay. So as we already we did last semester, I will teach the I will lecture, I will teach the introduction. Then the rest will be done in group presentations. So I will give you, I started with the group presentations. I'll give you the group presentations and when we are going to start with the group presentations. So for now,
Yes,
Yes,
some
sister.
some people are putting it in the chat that they can't hear me, and my network too is also not favoring me. So please, I beg you, check your laptops too. Maybe it's from your laptops or your phone. So we are looking at operative room theater, how the history of operating room theater. So operating room theaters had a raised table or chair of some sort at the center for performing operations. So okay, let me summarize it. Long ago, when they wanted to do any operation, they gather at a park. Then they raise a table or a chair that they will put the patient on or the client on, depending on where they are going to do the operation. Then the students, so this is how it looked like. Then